Hey friends, welcome back to Pediatric Survival Swim. My name is Allison, and today I wanted to talk about, once again, puddle jumpers and how they can be increasing the risk of dry drowning in your child if you use them. Now, this is not a parent shaming video at all. I understand that puddle jumpers are there for water safety. And if you are a parent, the reason you're buying puddle jumpers is to try to create the best kind of water safety you can to keep your child from having an accident. However, I wanted to give you kind of an education piece today to kind of give you so you can weigh your options, pros and cons, to seeing if puddle jumpers are a good fit for you and for your family and your lifestyle. Now, I do have to say that I have 4 children, and I have 2 children that do have and own puddle jumpers and use them. I will talk about when we use them and how we use them at the end of this video, but for now I wanted to dive in and kind of talk about dry drowning and define that a little bit for you. Now, I'm making this video because every year I have a couple parents that always come to me and ask me, should I be worried about my child and dry drowning? Now, dry drowning can be kind of misleading because dry drowning is kind of defined as inhaling water in such a way that the vocal cords spasm and air cannot get through. But let's kind of go in a little bit deeper. They're talking about the epiglottis gland, and that's the job of the epiglottis gland, which is the flap in your throat that keeps everything but air out of your lungs. So that's water, that's food, everything, that's its job. So whenever you talk about you drank something and went down the wrong pipe, well, it didn't actually go down the wrong pipe. Your vocal cords, your body's doing everything it can to bring that food back up or that water back up to keep it from going down into your lungs, causing you lots of medical issues. So that is not dry drowning. That is not what we're talking about. That's just choking. So what really people are trying to define dry drowning as is secondary drowning. And the funny thing is that secondary drowning and dry drowning aren't really medically accepted terms because they fall under the umbrella of just drowning. Fatal or non-fatal drowning. Those are the 2 categories that this is pulled into. So let's talk about dry drowning. Secondary drowning. Secondary drowning is when that water, either fluids from the pool or whatever body of water you're in, or from your own bodily fluids, fills up the lungs. Now, this is also called pulmonary edema, which is actually a medical term. And pulmonary edema does and can happen outside of the water, but usually it's already with a pre-existing medical condition that is already known about and well established. What we're talking about here is secondary drowning, dry drowning, that happens due to a drowning incident. So that's not why it's medically defined. It's because it's all related to the incident of drowning. So if at any point there is a child who is in distress in the water, they need to be pulled out and they need to be watched over carefully and examined. If at any point at all you suspect that a child has lost consciousness in the water, then that child could be susceptible to pulmonary edema or fluid getting into the lungs and causing many medical problems or some kind of infection to occur. And if that's the case, the child needs to be seen medically and will probably be staying overnight. Now, how does that relate to puddle jumpers? Well, it relates to puddle jumpers in a few ways. Puddle jumpers are put on children that are normally around, I would say, 5 and under, which is the exact age that is in the #1 spot for unintentional death, is under the age of 5. They're the most susceptible to drowning. And many of this is related to the puddle jumper, because the puddle jumper is kind of a way for parents to relax by the pool or in the pool and not have to worry about their child having a drowning incident. However, because puddle jumpers are used so much, many children do not get the appropriate swim lessons that they need in order to survive an aquatic fall-in if they don't have their puddle jumper on hand. This can also, if a drowning incident occurs, many times it is because the child goes under the water and is not able to properly have the correct breath control and breath control methods to be able to sustain being under the water for an extended period of time, which nobody is. 20 seconds is about the time it takes for you to lose consciousness under the water. However, if you are a child that has not been in swim lessons before, does not know the proper techniques for breathing while in the water, then your child can get very scared, which takes more seconds and more time off. And then the child could breathe at the wrong time, inhaling that water. And therefore that epiglottis gland could be not effective, because your brain is telling your body that you need oxygen, and so your body is a little confused about the environment around and inhales both water and oxygen at the same time in order to stay alive. So that is one way that puddle jumpers can really hinder that. And the second way is that puddle jumpers create a false sense of security in the water, and many times put our child in the vertical position for swimming. So people and parents swim with their child for hours on end in puddle jumpers, and this is what they look like, or maybe this is what they look like when they're swimming. They have a bicycle kick to them. Their head is usually like this, and maybe they're at a little bit of an angle doing a bicycle kick, but they're not completely vertical. Now, I have had many comments, not very nice ones, but that's fine, about how their child learned to swim in a puddle jumper. And that's great, that's excellent. However, I would love to know the age in which your child was taught to swim in a puddle jumper and what age you took them out, because puddle jumpers, for the little kids, the kids that are most likely to sneak out the back door, most likely to find a way into the pool when mom and dad aren't watching, are ages 2 to 3. So most of the time they don't weigh enough to be able to combat the restriction of the puddle jumper, and so it just keeps them above the water. However, a larger 4 or 5-year-old could learn potentially how to swim, probably not the most effective way, but it is possible to be able to swim in a puddle jumper, because they're big enough to be able to weigh this puddle jumper down in order to get themselves in a more horizontal position. So I want you to think about that, and let me know. I'd love to know in an email or Facebook comment or message about your experience with puddle jumpers, because this is an educational piece. There's, not a right or wrong. Every child is absolutely different, and children learn in different ways. But most likely, children do not effectively learn to swim in puddle jumpers. They can't learn the horizontal posture. They can't learn how to roll and properly float for minutes on end if needed, and then how to flip back over and get to a wall. Usually when a child falls in, they're close to the wall, but they're not able to effectively get to that wall to get safe, because their head is back. They're in panic mode and they're bicycle kicking and reaching for that edge. But because they're in a vertical position, they just keep going down and down and down and running out of energy, running out of oxygen. You can't effectively breathe in this position. So it doesn't take very long for a struggling swimmer to fall under the water and fall prey to a fatal or non-fatal drowning incident. So dry drowning, secondary drowning, not really medically accepted terms. They fall under the umbrella of fatal and non-fatal drowning incidents. They don't happen outside of the water. So your child is not going to inhale water and then a few days later pass away from inhaling that water. Something else is going on. If your child did inhale some water and there wasn't really a drowning related incident, you will notice problems that keep arising. Lots of fatigue, lots of coughing, fever, a change of mood, just drastic changes. This is not something that you're going to notice a week later. It's going to come on and be an onset going thing, and your child's health is going to deteriorate, and it's going to be very noticeable. So then you need to, of course, go see a doctor as soon as you can. Now, my children own puddle jumpers. I have a son who is 6 and I have a daughter who is 4. We have a boat and we have kayaks, and we live on a river. Our river is literally in our backyard. We have puddle jumpers for our boat and for our kayak. We do use these puddle jumpers on these vessels and anything that has in any body of water that has a current that could carry them away, where they could possibly not be strong enough to get back to shore safely on their own. So that is times that my children will use a puddle jumper, same as my other 2 children when they wear their life jackets. However, they do not go to the beach or go to the lake or go to the river and swim around in these puddle jumpers and create that vertical position and that those bad habits of swimming. That is not something we do. Our puddle jumpers don't get wet. They stay dry. They are not used unless it's an emergency. Your boat flips over, your kayak flips over, your kid falls out of the boat, falls off the dock or something, then, you should be worried potentially about your child hitting their head or being disoriented. So that's what the puddle jumper is for. It's for current waters that have currents and for water vessels as well. It is not for the swimming pool, because many times what happens is that you will be in a puddle jumper all day long, and then you go inside for a rest, or you go to reapply sunscreen or have a snack, and that child that was wearing that puddle jumper is seen in the water but without the puddle jumper. 70% of drownings happen in a backyard pool or retention pond, usually during non-swimming hours, non-swimming time. So there was never a chance for that child to go and put that puddle jumper on before he or she went off into the pool by themselves. So that's why this video is so important. Please share with your friends and family if you think that this will be helpful for them. Again, this is not to parent shame anybody at all. We own puddle jumpers. We just have to use them in the right place and right time and the most effective way, which is at a time where we're not going to be actually using them in the water and creating a bad habit. So I hope you found this video helpful. Please feel free to contact me. You can contact me at Allison@pediatricsurvivalswim.com. I'm also on Facebook. You can comment or message me there. And I hope to see you again in the next video. Have a great day, guys. Thanks.